Hi, my name is Dan Cronin. I just had the procedure done through Dr. Steve Roman, and he asked me to say a couple words. Considering that I am really a good and recent candidate for this procedure, I have suffered with very chronic knee pain, sports-related injuries. I've had 3 arthroscopic surgeries on my left knee, to the point where I had degenerative joint disease in both knees, so the doctors told me they couldn't really operate on me anymore. I had probably for the last 5 years cortisone shots, Monovisc, Synvisc, and I understand now the long-term detriment to using cortisone, because you're really just numbing the injured area. You're not really doing anything regeneratively. And so I then started to learn about the regenerative cells that everybody has in their body, and started to understand how bone marrow stem cell works, and most recently learned about the fat cells. And so just had the procedure done, and I have to say, no more painful than even when I was doing the Monovisc shots, with much greater long-term results. So it's very minimal amount of pain at the injection site, and I just had it done literally 10 minutes ago, and I feel great. I will also add that, like myself, a lot of people probably out there don't really understand what stem cell therapy really is. Everybody has regenerative cells in their body. You had them, and that's the cells that make your body grow. Once you reach full adulthood, those stem cells kind of go into more of a dormant state. That's the reason that they have to harvest them in the areas that they harvest them. But we all have regenerative cells, and this is a procedure that is, in my opinion, just scratching the surface in its popularity. So when a lot of people think about stem cell, they think of embryotic, which might have some negative connotations, but this has nothing to do with that. So I would urge you to definitely go on YouTube and Google and research it a little bit, and certainly speak to Dr. Roman about it. I think we're just scratching the surface in terms of what we're able to do with stem cell therapy.
I'm so glad you came in today, Danny. Danny was told that he needs a knee replacement, and he came here to see if he had any options. So today we performed a bilateral knee regenerative procedure, and we're going to see you back in about 6 weeks, and hopefully at that time we'll get to see preliminarily how this is working out, and I'm hoping that we can go ahead and keep you active on the ski slopes without that surgery.
You're giving me a new lease on life, Dr. Steve. If you are like me and the knee doctors out there don't give you the option of regenerative stem cell therapy, you need to talk to this guy right here, Dr. Stephen Roman. Another thing that I want to make sure that I point out is that in the 5+ years that I was going for the shots, never did anybody tell me about stem cell therapy. I was always told that my only other option was to have knee replacements. So one of the things I learned about when you're getting cortisone injections, one of the reasons that you can only get it done a couple times a year is because it really does nothing to get to the root problem of the degenerative joint disease, or the arthritis in my case. So it wasn't until I started to talk to Dr. Roman that I learned about the options of regenerative stem cell therapy.
So if you've been told you need surgery, please come and give us a visit to see what your options are.